We have gone into homesteads of 30, 40 adults of voting age, and all of them have confirmed that they will be voting for the African National Congress.
ANC First Deputy Secretary General Nomvula Mogonyane says the party has mobilized leaders from African countries to be observers during the national general elections. She was doing a door-to-door campaign at Mkambatini local municipality.
You must remember what the evidence of the Labour Party is that they were being kicked off, so there'd be no evidence of uploading.
Also, 3 political parties, namely the Labour Party, the African Congress for Transformation and African Alliance of Social Democrats, made representations at the Constitutional Court today. This was over their exclusion from the 2024 general elections.
Welcome to Elections 360 Daily, your go-to elections content show. Airing on SABC 1 Mzansi for sure, SABC Lihaye on DTT, and SABC News Channel 404, every Monday to Thursday at 5 p.m. We're just 20 days away from South Africans choosing new leaders to take the nation forward. Today, we'll delve into the state of public health care in South Africa. I'm Buhle Keleba, joined by Mkolisi Masango. Hi, Mkolisi. I'm good. How are you?
I'm all good, and let's get it straight into it today. And of course, just over 30 years of democracy, we have read horrific stories on the country's public health facilities. Remember, Gay, you can be a part of this conversation by calling us on 011-714-0726 or 0727 or 0728. Also, make sure that you be in touch with us on our social media platforms. We are on X as at SABC Izindaba, as well as on Facebook as at SABC Izindaba. Just make sure that you use our hashtag Elections360Daily. This now makes it easy for us to pick up all of your engagement right here on the show. And of course, we never have these conversations by ourselves, which is why we're joined by our studio guest here today, and Asipe Funda is attorney in the Health Rights Program from Section 27. It's great to have you on the program. Welcome to it. I'm looking forward to our engagement today.
Thank you, Nkolisi. Thank you for having me on your show today.
But first, Buhle takes us to Mpumalanga. Over to you, Buhle.
Thank you, Mkolisi. Let's take you to Mpumalanga. This province has opened several healthcare facilities since the country attained its democracy in 1994. However, some members of the public are still not satisfied with the current state of the province's health centers. SABC reporter Michael Mdluli compiled this report.
Long queues of sick patients waiting to be assisted. This has been the daily occurrence in many health facilities within the province. To add to the realities of what patients have to go through is the poor state of some of these facilities. Some patients even claim to have been harassed by people whom they trust with their lives.
When I got to Ward 4, the nurses were already discussing about me, how they're going to chase me out, because I reported one of the nurses previously to management. So the disruption started there, the nurses ill-treating me.
These centers have now turned into playgrounds for criminals, with a notable number of robberies and disruptions of services.
Such incidences compromises the access of quality healthcare services to the communities. And you also mentioned that the department will continue to engage the security service providers contracted to the department to engage them so that we can constantly and continuously find ways of better protecting healthcare facilities.
Recently, the National Department of Health Ministry had to come down to Temba Hospital following the shutdown of services after an alleged incident where hospital staff was harassed and assaulted.
I came here to meet with the MEC and also briefly with the Premier to express our support in terms of the interventions necessary to make sure that something like this should never happen again.
Efforts have been made by the Department of Health to catch up with the provision of adequate healthcare services amidst all these challenges, with several clinics having been built and opened, including the recently opened Petal Hospital, equipped with high-quality technology and equipment to ensure the rendering of quality health services. The department received a budget of over 17 billion rand for the 2023-2024 financial year to assist in improving its services, including the maintenance of existing infrastructure and the building of new centers. Hopefully, these monies will be used for what they were allocated for and help millions who depend on public health in the province access quality health care. I am Michael Mdluli for SABC News in Bombela.
That report coming in from Mpumalanga. And of course, to delve deeper into today's discussion, we bring in our guest, Asipe Funda, attorney in the Health Rights Program, Section 27. And she joins us now on the program. So it's great to have you on the show. So, horrific stories we're seeing there, first of all, in the package. Let's first of all get your reflections, but also just to highlight some of the underlying challenges that we're facing right now with our healthcare system, particularly the public healthcare system in the country.
Policy, what was described by the resident in Mpumalanga is unfortunately a reality for many South Africans who depend on the South African public healthcare sector. You know, the sector currently is facing chronic staff shortages, stock shortages in terms of medicine, and also as well as not being able to carry the number of patients that come into the facilities, the healthcare facilities. There's so much to appreciate about how far we've come, though. If we're going to look at pre-1994 and what the healthcare sector looked like, we had a healthcare sector that systematically excluded a large number of people in South Africa. There we are speaking about black people. So that was the health sector back then. Post-1994, we saw the current government creating a system that catered for more than 80% of South Africans. Currently, the public healthcare sector caters to about 84% of South Africans. That is a huge number. And access to healthcare has improved, particularly in urban areas. However, we have to ask ourselves the question about where should we be with the resources we have. What we've seen as a trend as an organization is the de-investment by the government in public health care. So what we are seeing is called an austerity measure. So every year, the government is chipping into the healthcare budget and actually cutting the spending on per patient, as well as conditional grants that are catered for by the Treasury Department. So now, we have a healthcare sector that caters for 84% of South Africans that is slowly being chipped away. And even in instances where there are funds allocated, we've seen a trend of underspending, where we saw recently Section 27 and other organizations that cater for cancer patients had to actually protest and go to the Gauteng Department of Health in the past few weeks. Yeah. Because there had been 784 million rands that was set aside by Treasury to cater for radiology patients. That money was unspent.
Yeah, I want us to also just to bring in also Dr. Nicholas Crisp, who's the Deputy Director General for NHI from the National Department of Health. Thank you so much for your time, Dr. Crisp. I'm sure you caught parts of the conversation that we're having right now. And to bring you in now, I'd like to find out if would NHI be the solution we need, or a solution that would work, help curb these problems that we're seeing within our public healthcare system?
Yeah, thanks very much, Melissa. So I'm afraid I was not able to hear any of the previous conversations, so it's difficult to get the context. But in answer to the question, we have massive problems and challenges in both the public and private sectors in the country. And the problem that we are trying to address is inequity. These inequities are both within the public sector and between the public and the private sector. And we are spending way more than countries with similar GDPs to ours on healthcare. And within the public sector, we are spending more than we've ever spent before on healthcare. We're spending 15% of government spending on healthcare, and that's risen from 14% 8 years ago. So the challenge is that the costs are rising very fast and are outstripping our ability to keep up. And we are spending 51% of all of our health spending in the private sector. So we need to find ways to get all these resources accessible to everybody, irrespective of whether you're rural or urban, or whether you have deep pockets or you have very shallow pockets. So what the National Health Insurance is aiming to do is over the coming years, and we need to recognize that this is a long-term reform, over the coming years is to pool our resources and do away with all these multiple financing streams, 10 government financing streams and 71, at least 71, probably more, public financing, private financing streams, which all result in duplication, dropping patients between the exchanges of the money and the way in which services are paid for, and synchronizing the way in which we run the services. What is often misconceived.
But also, Dr. Crisp, if I may come in there as well, you know, there are so many voices to this conversation on NHI as well, the likes of the former president of the HPCSA also coming to say that the NHI is one of those concepts that were not really thought of. There was no mind that went into it, into thinking about it to be a solution. What would your response be to such?
Well, that's his view, and whether Dr. Letlapi was involved in the Green Paper, the two white papers, the original white paper on the reform of the health system in 1995, the 5 years of debates through Parliament, he's entitled to his opinions, but he's not, we wouldn't all agree with him that it's ill-conceived. There are many countries who've embarked on similar routes to ours. And obviously, from where I work in the National Department of Health, I wouldn't agree with them either. There are some things we do agree on, but on that we don't agree.
All right, Dr. Crisp, let's park it here for now because we need to take a quick ad break. When we come back, Buhle brings us more on the program. Stay with us. This is Elections 360 Daily.
swibedhlele swa mfumo swo tala swa kona swi kahle swi kona swo swi nga ri kahle swi kona leswi nga kahle and then like ni nga vulavula hi xa Ellen Joseph na Express ku fanisana na lani wa ntshungulo kona Ellen Joseph van khome kahle.
In terms of medications but they are short what but for me overall like it was fair considering fact that it's a public institution.
Swibedhlele swa swi nne swi ndina nga tshithu tshithihi tsha uri uya u dzula tshifhinga tshilapfu thuso u sa yi wani.
Mina into engiyibonile hayi bangiphethe kahle kakhulu umntwana bamphethe kahle uzale kahle nona noma sengiyomlanda vele hayi basiphatha kahle kakhulu azange sibe ne problem angina ne complaint.
Those were the views of public facility users sharing their experiences. Welcome back to Elections 360 Daily. Shortage of staff, equipment, medicines, old unmaintained infrastructure are just some of the issues facing the public health sector. We spoke to different political parties and independent candidates about their strategies to fix the public health care system and their view on the NHI. This is what they had to say.
The proposed National Health Insurance Bill is controversial not because of the underlying fundamental principle, which is to provide universal health coverage. The real controversy in NHI is the capacity of our government to implement it. Is our government capable? Has the quality and standards of public health care improved in the last 30 years?
When I look at the NHI, I see a system that wants to control which medical practitioners will be able to consult, or even the medicines that we can prescribe can be prescribed to us. I believe that in order for us to fix the public system, we need to employ more public servants. And also we need to empower citizens how to remain healthy.
I believe that the introduction of the national health insurance in South Africa represents a very fundamental strategic intervention that will ensure that there is universal access to basic health services by all the people of South Africa. But over and above that, it creates the most important protection of the rights to health that are enshrined in the constitution of our country for all the people. This is so that the vulnerable groups and the marginalized people who lack the necessary resources to access health.
The EFF government will ensure 24-hour idle clinics and upgrade hospitals such that each district has a specialist hospital with a minimum of 450 beds and dignified gender-based violence victim support centers.
And of course, the conversations continue right here in studio. And of course, do you think those strategies will work? Do let us know on all of our social media platforms. Asipe Funda, attorney in the Health Rights Program, Section 27, and Dr. Nicholas Crisp, who is the Deputy Director General for NHI from the National Department of Health, continue with the conversations with me. So, Asipe, let's get your reflections first, but I also want to know what's your take on NHI? Do you think that's the solution we need?
Ngolisi, I wouldn't go as far as saying that right now it's the silver bullet that we need. As Dr. Crisp indicated, the system we currently have is very unequal. We have a public healthcare system that's carrying 84% of the population, and we have a private healthcare system that's carrying about 16%. Something has to happen. Reform of some kind has to happen. And our understanding of the NHI is that it seeks to transform the healthcare sector in South Africa so that there's equitable access to all, whether they are in rural areas or in urban areas, as well as the fact that they can afford it or not. So that is an important part of the objectives of the NHI, which we fully agree with. So as an organization, we've been taking part in the consultative processes. We've commented on the bill at all different stages since 2018. We have raised concerns with the bill as it currently is, particularly because the healthcare sector is a corruption-vulnerable sector. You are saying that the NHI is going to be the single purchaser of healthcare in South Africa. You then have to look at the amount of procurement that will need to happen there. So now we need appropriate governance structures to be built into the legislation.
And it's actually speaking of those structures, as it is right now, Dr. Crisp, we are grappling with unemployed doctors in the country. You know, there's a shortage of doctors whilst we still have unemployed doctors. Do we really have the capacity to implement NHI, also looking at it from a competency perspective? Okay, Dr. Crisp is frozen there. We'll endeavor to bring him back on that line. And also, one of my takeouts, I think, was from those Voxies that we've just had right now from the residents there, talking about their experiences on our healthcare facilities. It's just a drop in the ocean that you go and find that someone had a pleasant experience at a healthcare facility, particularly a public one. Some of those experiences would be in places such as the far-flung rural areas. What is it that we're not doing right?
Ngolisi, I believe it's in resource allocation. We are not utilizing the resources that we have appropriately. Particularly in rural areas, access is still a huge issue. Also, when it comes to emergency healthcare services, most people in rural areas have to pay exorbitant amounts to be able to reach remote hospitals that are distances away from those communities. So it's important that the NHI brings inevitable solutions to that. You know, if we're saying that...
And I actually want us to touch on those solutions. Let's do that when we come back from the break. We're back with you straight after this. You're still watching Elections 360 Daily. And we're just about to wrap up our conversations on today's show. We're looking at South Africa's healthcare system as well as its issues thereof. And of course, we continue with our guests right here in studio. And Asipe, I think so many insights have came through throughout the course of this conversation. And first of all, I think we all agree that there is a problem with our healthcare system here in South Africa. Let's move about consolidating and finding solutions and what you think would work from your vantage point.
So looking at the healthcare sector as it is right now, what we need is effective utilization of our resources. We need to stop de-investing in the public healthcare sector. We need to stop cutting the budget that is dedicated to access to healthcare in South Africa. Secondly, when there are funds given to either a provincial government or in the form of a conditional grant, those funds must be utilized. Those are the most important parts because there is money. How it is spent and also ensuring that we continue to invest in the healthcare sector so that we can improve our hospitals, our healthcare facilities, as well as to ensure that there is more access to medications and so forth.
Okay.
One point I need to emphasize.
Just a quick one, yeah.
We have a working healthcare sector. It's not perfect. And when the NHI comes or any other transformative policy or law that will come into place, it needs to protect and preserve that public healthcare sector because it carries so many of South Africans in the country.
And Dr. Crisp is now on the line for us. Dr. Crisp, just a quick one to wrap it up for us. We have about 30 seconds for you.
Yeah, sorry, we had technology challenges, but I heard a little bit about the NHI not being a silver bullet, and I agree with that. There's going to be hard work to reform the system. I want to agree with the comment that we actually do have a functional health system, despite the many challenges we have. The challenge, of course, is that we need to centralize the way in which the budget is managed, even in the public sector, because you can't have 10 different departments spending money in different ways, and that is a primary part of the challenge at the moment. Also a challenge is having 71 different funding streams in the private sector with lots of duplication. So what we are looking at is not to undermine either one of the sectors, but to get them to work together.
Okay, Dr. Nicholas Crisp is the Deputy Director General for NHI from the National Department of Health, as well as Asipe Funda, attorney in the Health Rights Program, Section 27. Thank you so much indeed for your time and navigating this conversation with us. Well, we're done for today. We do this again tomorrow.
We do it again, same time tomorrow, crisscrossing South Africa.
Indeed. Till next time, take care.